Today, let's talk about the truth of pain injections for your spine. Many places promise to fix your spine problem with a simple injection. Sounds tempting, right? But an injection, though quick, may not completely fix your problem. May also lead to bigger problems down the line. Steroid injections in the spine often give only temporary relief. In fact, most epidural injections provide relief for about couple of weeks or couple of months, and some people might get it a bit longer also, but some people may also not get any kind of relief. So if your pain is gone today, it might just creep back in a few weeks or months. Now I'm not saying that injections have no use, but they can be very helpful in certain conditions for a short-term relief, rarely for long-term relief in a few patients. For example, if you have a slipped disc pinching on the nerve, you are not able to stand, walk or sit, an injection might calm down the inflammation and give you a window of relief. Maybe enough time to do physiotherapy and get back to your normal routine with medications and strengthen your back. But you should understand that injection isn't making the disc go back in place. It is not a permanent fix. So in few patients, there is actually a risk of worsening the symptoms, especially in patients with disc problems, with foot drop, that is a neurological compromise, or bladder and bowel problems. These injections might actually delay the actual real solution. So these people will get into serious complications. So I've seen patients who kept getting an injection for years together while the underlying problem is always there, like a severe disc herniation or a spinal instability. It is getting worse day by day, but by the time they came to me, the condition has progressed so much that eventually the normal surgical treatment also may not give them a complete relief. Even scientific evidence strongly recommends against routine spine injections for chronic back pain. Why? Because research showed these injections often offer little or no long-term benefit compared to a placebo. So imagine undergoing a procedure, spending a lot of money, maybe even risking side effects, and in the end, no better than a sham. So yes, there are side effects and risks, but you should understand when to get it done, whom to get it done, where to get it done. So let us understand when actually to get an injection done. Yes, you have a disc problem which is leading to difficulty in walking, sitting or standing, or rarely it is causing a limping gait. That is, probably you are having so much pain that you are not able to walk straight. So these conditions, even after giving medications or some kind of physiotherapy also you are experiencing it, then probably injection is a choice. So when given, you might get instant relief which can last couple of weeks or couple of months, but we are not sure how long it will last. So these kind of situations are always easy to get done with injections. But yes, if couple of times given an injection, still you have such kind of problems which are increasing in severity, then probably you are not a candidate for another injection. So you should choose the option of injection wisely. You might as well get a new MRI done, meet your spine expert, decide on further strategy, whether it is a surgery or something else which can be done to decrease your pain. So you must understand that if you are having bowel and bladder symptoms, that is, you are not able to hold your urine, or you are having constipation, or you are having weakness in your legs, then probably you are not a patient for injection. Meet your spine expert and decide for a permanent relief rather than chasing the temporary relief, which can sometimes lead to worse outcomes which may not be reversible. Who is giving the injection? Is it your spine expert or just any other doctor who is just trained for the injections? And remember, whether it is an injection, therapy or surgery, the treatment should be tailored to fixing the root cause, not just papering over the symptoms. If you are unsure, ask your doctor what happens when the injection wears off. What's the long-term plan? A good doctor will always have an answer. Temporary relief can be a blessing, but a permanent cure is the real goal. We are here to help you find out that cure safely and effectively.